Breaking news at 9. Reportedly, there was a man named Matilda which died in a tragic way, shocking the entire nation. Matilda is 5 years old, kept by her owner for the purpose of show jumping. The story goes, Matilda kept on practicing for her daily routine. She accidentally banged her head on a pole. Ever since that day, Matilda has been experiencing neurological symptoms and episode of convulsions daily. The owner was worried sick since she was very precious to him and also kept as a breeding mare. The owner was worried sick since she was very precious to him and also kept as a breeding mare. So, the owner gave Matilda Nembutal or pentobarbital to manage her neurological symptoms. Several days later, the trainer noticed that Matilda was shivering and her pupils were dilated.
She was shivering! Oh my god! What happened to Matilda?
She was also found to have a very shallow breathing and her pulse was markedly higher above normal. The only visible lesion found on postmortem examination was enlargement of the spleen.
Look! The spleen is so big!
Oh my god! Why the spleen so big?
So we gathered some experts to look up upon this case and discuss what might have happened to the poor Matilda. So firstly we have Dr. Sri.
Yeah.
So Dr. Sri, can you explain how did the mare actually die?
Okay, according to pathophysiology, the horse banged the pole. After it banged the pole, it will cause skull fracture. Then it will develop into some episode of seizures and some traumatic injury. Since the farmer gave Nembutal, Nembutal is a trade name for pentobarbital sodium. So after the farmer gives pentobarbital, the pentobarbital will go to the central nervous system and it will depress the cerebrum cortex, hypothalamus and then the motor center of the brain. If the pentobarbital given at the high dose, it will cross the blood-brain barrier and it will depress the respiratory center too. This leads to suffering of the horse and then some severe lethargy, coma and the dilation of the pupil. This prolongs, it will cause death. And high dose can also cause the enlargement of the liver too.
Okay, thank you Dr. Sri.
Okay, thank you.
Okay, so from what Dr. Sri has explained just now, so are you saying that pentobarbital is the cause of all this?
Actually, pentobarbital will depress the sensory cortex and it will decrease the motor activity, also alter cerebral function. Other than that, it will produce drowsiness, sedation and hypnosis. By taking these drugs, it will take immediate onset following the IV administration and the duration of the drug is about 3 to 4 hours. The route of choice is IV if possible, but then the other alternatives route is by intraperitoneal and intrathoracic if the venipuncture is difficult to achieve. The intrathoracic route is usually the last resort. Yeah.
Okay, thank you for that, Dr. Acha. How does pentobarbital actually works inside Matilda's body, Dr. Nadia? Can you explain?
Okay, thank you, Miss. So the drug will undergo 4 steps: absorption, distribution, metabolism, and elimination. Okay, so in absorption, the drug will be absorbed in varying degrees. The maximum time is 15 minutes via intravenous, which will maximize the central nervous system depression. After absorption, the drug will be distributed to all body tissues and body fluid with high concentration in brain, liver, and also kidney due to lipid solubility. And then the drug will be distributed into mammary gland. After distribution, the drug will be undergo metabolism. The drug is metabolized by an enzyme called hepatic microsomal enzyme system. Okay, after metabolism, the drug will be eliminated in the urine. The drug may also be excreted in feces, but it is less common. That's all.
Okay, thank you Dr. Nadia for that wonderful explanation. Okay, thank you for being here, doctors. Now we will see if there's any possible treatment or any chances for Matilda to get better in the first place. After that, we will see how the consequences of the drugs interact with the other drugs in the case of convulsion. That is all from me. Reporting Azmina Ahmad. This is bad news.
So, here comes to question 3. Suggest a mechanism of reversing the neurological symptoms of multita or any possible treatment that can apply to multita to reverse the condition of her. So, from our opinion, we will use diazepam and phenobarbital as a treatment instead of Nembutal. Diazepam can act as anticonvulsant. Anxiolytic and skeletal muscle relaxant by enhancing the GABA activity through binding to the benzodiazepine site of the GABA receptor. So, what is GABA? GABA is the major inhibitory mammalian neurotransmitter. So, this is a schematic diagram of GABA activity mechanism. There are two neurons here, which is neuron 1 and neuron 2. When there is a excitatory nerve impulse come in, GABA storage sites in neuron 1 will be stimulated to be released from the neuron 1. Then the GABA will react with receptors on neuron 2 and cause an opening of chloride ion channel. When chloride ion able to enter into the cell, the ongoing nerve impulse will be inhibited. So, this is when benzodiazepine come in. Benzodiazepine, also known as diazepam. Diazepam will then binds to the booster site of GABA receptor. And enhance the GABA inhibitory effect. Thus can help in this case by enable the multita to experience anticonvulsant, anxiolytic, and skeletal muscle relaxant. In the other case, the phenobarbital is believed to mediate its anti-epileptic effect through affinity to the GABA receptors. It can also blocks the AMPA receptor. Thus inhibit the release of excitatory neurotransmitter glutamate. This combined potentiation of GABA and inhibition of glutamate leads to reduced neuronal excitability in multidrug case. So, multidrug can change from excited state into a more calm state by using the treatment of diazepam and phenobarbital.
Hi, I'm Dr. Alia, and today I'll be talking about the interaction of drugs. Basically, what would happen if you consume other drugs along with Nembutal, and what would happen in the animal. So the first drug is Nembutal combined with opioids and antihistamines. So what would happen when these two drugs mix is basically increased effects of the antihistamine and opioids. Next, what would happen if Nembutal were to combine with alcohol and CNS depressants? Basically, the depressant effects will increase if you combine these two together. Next, what would happen if you combine Nembutal and anticoagulants, beta blockers, and calcium channel blockers? What you will get is a decrease in activity of the drugs, which is an undesirable effect. Next, what would happen if you combine Nembutal and other anticonvulsants such as diazepam? Basically, what you'll get is a reduce in serum concentrations of carbamazepine, valproic acid, and succinimides. Next, if you combine Nembutal and corticosteroids, the resulting effect is the reduced effects of those corticosteroids. Next, if Nembutal is combined with estrogen-containing contraceptives, what you'll get is reduced effects in those contraceptives, which is also an undesirable effect. Next, what will be the effect of combining Nembutal and griseofulvin? Well, the resulting effect would be low levels of griseofulvin in the blood, which would mean that your drug has low effectiveness. So I think that's all for drug interactions from me. Now I'm going to pass it to my colleague, Dr. Shanas, to explain more about drugs that would worsen the condition in Matilda. So I'll pass it to her.
Okay, thank you, Alia. Okay, now what is the effect when pentobarbital been mixed with alcohol? The effect is it will cause dizziness and drowsiness. Okay, next, when pentobarbital been mixed with morphine, it will cause CNS depression and will lead to respiratory distress such as coma and also will lead to death. When pentobarbital been mixed with the phenobarbital, it will cause dizziness, drowsiness, confusion, impairment of motor coordination.